Hello, and welcome to Ending Physician Overwhelm. I'm your host, Dr. Megan Mello. I'm a family and obesity medicine physician, as well as a certified life coach for physicians. In this podcast, we talk about how the learned habits of people-pleasing, perfectionism, and a lack of boundaries show up in our lives and how they contribute to burnout, exhaustion, and overwhelm. The healthcare system is broken, my friends, but let's not wait for it to be fixed in order to feel better. Well, hello, my friends, and welcome to another special guest episode. I am so thrilled today to be talking to Dr. Jeannie Lawrence. Dr. Jeannie Lawrence and I are both a part of the EntreMD Business School, and she is someone that I've been wanting to get on the show for a very long time now to really talk about her work. Dr. Lawrence, welcome to the show.
Thank you, Dr. Megan Mello, for having me here. This is such an honor, and I really appreciate it.
So just by way of introduction, I'll share that you are a psychiatrist as well as a fellow physician coach and practicing out of Virginia and spending, some time doing the physician medical psychiatry work and spending some time coaching primarily high-performing women who are experiencing issues, with anxiety, depression, stress, and, kind of this outwardly looking like they have it all, but inwardly feeling like they're really struggling. And so I'm really excited to talk with you today and hear more about that work. If there's anything else you'd like to share with the listeners before we get started, please jump in.
Thank you for the intro. I appreciate it. I specifically coach women physicians, so not high-functioning women in general, but women physicians specifically. And, our goal is helping women physicians thrive. And I do speak a lot about, that disconnect that is there a lot amongst my clients, and that I've experienced myself, where things look really great on the outside, inside don't feel as great, and can really be a hang up to the thriving that we want to get to. And so, that is my work in the coaching area and clinically too. So,
okay. And so the way that we start out our conversations is really sort of sharing our own story. And you've experienced some pretty big transitions in your life after realizing that you felt stuck and unhappy, even though, again, on the outside, everything, seemed to be going well. You seem to have it all. Walk us through, kind of what was going on and when you really realized that there was a problem.
So my story kind of ironically started when everything was going really, really great. Everything that I had been working for years had finally come together, right? This was right after residency. So like my 12-year trek through med school and residency and undergrad was finally over, and I was an attending. And at the same time, I was getting married. And so my, search for love was also over, and I found, my person and got married. And that was really exciting. And I was, making no money as a resident to finally getting my big time attending job. And I was moving out of my 1-bedroom apartment to my first big house. And so, a lot of really great things were happening that
hit all the milestones, right?
I hit them all kind of at the same time, and imagined, of course, that since I'd been working so hard towards these things, that I would be happy, that this was my happily ever after. And it definitely looked like that. My family and friends were, cheering me on and wishing me well and congratulating me. And don't get me wrong, that was a very happy time in many ways, but there was beneath the surface, not what I quite expected, right? There was struggle, like as I tried to make all these transitions at once. It was really hard. And I think what made it harder really was my belief that I couldn't talk to anybody about the fact that I wasn't as happy as I thought I should be, and that I assumed everybody thought I should be, right? Like, how could I complain when I have all these things that, a lot of people around me thought was so great? How could I complain when I just had this amazing wedding and have this big time job and all these things? And so I ended up really internalizing the things that I found difficult and challenging and tried to deal with them on my own. And I think, that was a habit that I'd gotten into just being a physician, right? We're generally very independent and self-sufficient and, even may not even as women sometimes don't even expect a lot of support in our male dominated medical culture, right? You definitely may not get it. And so dealing with things on your own internally for me had become was very natural, right?
Yeah, it's just the norm, right?
It's just the norm. Yeah.
Yeah.
And I felt like I had no other options. And so I really think in retrospect that delayed, of course, me reaching out for support. I eventually did. It took a lot though for me, right? It took a lot. And when I think back to it, what really kind of jolted me out of the space that I was in, right, where again things were looking great on the outside but not feeling as great inside, was that the way I was feeling was starting to affect people that I cared about, right? So I could see the effect of the way I was feeling on my husband, for example, or seeing that effect like in my home. And then I was willing to seek some support. And I see that a lot actually with the women physicians that I work with, that sometimes we're kind of used to the struggle and we're okay to kind of suffer through things for a while on our own, delay getting any support, telling ourselves we need to figure it out on our own until things get bad enough, right, where there's some spillover into other areas of our lives and other people are affected. And so anyway, that's where I found myself in that. And that's when I started shifting directions, right, and looking outside of myself for a bit of support and started my journey forward.
Oh, that hits home. I can think of a time that all of a sudden, I was pushing through, persisting, and all of a sudden I couldn't sleep. And then when I couldn't sleep, I was like, I will hurt somebody on accident here if I keep going, right? The body, shuts us down, or something happens, right? It starts to affect other people. So for anybody who's out there listening to us share our stories, we don't have to let it get to that point before we get help. Yeah. Let's just start with that little nugget for everyone.
So important. I mean, it's so important to hear that. Because we have the opposite idea. People have the opposite idea that it has to be really bad to seek support. And actually, I hear that a lot among women physicians who finally get some help, thinking that, well, I didn't come in before because I didn't think it was that bad, or other people have it worse than me. Those kind of things your brain will come up with and keep you from seeking help until it's, things are far gone. So ignore that thought and support sooner.
That's optional, and we can put that one aside. But such a common refrain, that we hear. So I want to talk a little bit about your work in psychiatry. So, for those of us who are not psychiatrists, who don't, who may have some influence, of course, I do some mental health as primary care provider, but that's not exclusively what I do. But I think we can sometimes have this notion that people who work in mental health, psychiatry colleagues, psychologists, therapists, that you all have your mental health really figured out. You have the balance thing figured out. And, I think there can be this sort of dangerous myth that kind of goes along with that. And what I've discovered, of course, in taking care of mostly like therapists or, RNs, is that we often have a lot of struggle with our own mental health, kind of within the practice of medicine. And so I want to check in with you and see, like, what do you think that is? And What do you think that people who, kind of work within mental health or work within healthcare in general really need to think about differently in terms of mental health?
Yeah, that's a big question and a loaded one, and a really good observation, though. And I want to take a step back on that, because you talked about how non-psychiatrists maybe imagine, right, that people in mental health have their mental health totally together, and how that is a dangerous misconception. And it is, and I'll talk about that in a second. But even before that, right, I think that physicians in general, a part of why women physicians, because that's my area of expertise and yours as well, struggle alone for so long, is that same misconception that if you're a doctor, then you have things figured out, right? Like, right? Like you have it all. You have the education,
what to do and how to do it.
You're very professional. You're all buttoned up together. You have the means, all these things. And so people who are not in that group, whether you're talking about physicians in general or women physicians or psychiatrists, people outside of that group have these misconceptions that separates that group, right, from everybody else in their mind, and a bit on a pedestal. And that's a really dangerous and lonely place to be. And so I just wanted to, I guess, talk about that.
I think that's an important way to unpack. Thank you. I threw a lot at you with that question.
No, it's fine. Yeah. But I think it's broader than even just, psychiatrists versus non-psychiatrists, but also, physicians and non-physicians. So yeah, I could talk a lot about that. So to get back to your question though, it's true. It's all a myth, right? What I think we all need to recognize is that we're all human beings, right? Like our station in life and our education and our professional role doesn't take away from our humanity. And yet our training kind of beats that out of us in a way, right? We are kind of, just talking about physician training in general, all of the things that we need as human beings, right, go on the back burner, right? We go without sleep for a couple of days at a time.
For a long time.
Yeah. No bathroom breaks, lunch may be that granola bar that's all crushed up in your pocket if you're lucky, right? Instead of sitting down like a person and having a meal like in the middle of a long shift. And so, yeah, there's a lot of messaging, right, that patients are humans, patients have needs, but those who take care of patients are somehow superhuman, right, and don't have those same needs and aren't humans in that way. And so I think the whole point is that we have to recognize that psychiatrists are human beings, doctors are human beings, mental health or non-mental health, all healthcare professionals, we're all human beings, and we all have those same human needs. And when we see each other like that, instead of putting one group in a bubble or on a pedestal, then we can kind of wipe away some of those misconceptions that leave some certain people right out and kind of lead to that silent suffering by themselves. So your other question was, I want to make sure I cover it, but was about specifically about psychiatrists and mental health professionals.
And kind of possible solutions, to thinking about the balance thing and, kind of taking care of mental health.
Yeah. I get it. Like you would think that like a mental health professional, many people think that they have it all figured out when it comes to balance. It's totally not true. Part of my story when I was delaying my own care and support, right, was that I was a full-blown psychiatrist by then, right? I was a full-blown board certified psychiatrist and therapist, and so that did not protect me in any way from struggling in my own way. And even though I knew the importance of mental health support, I took a really long time before reaching out. that's a message that I want to share, right? Like that our degrees, whatever they are, whether it's your MD or DO or whatever it is, doesn't protect you or mean that you have it all together in that area, or can even see, your own need for support. So, in terms of solutions, I think that for me, what has become very important, and I see being important, amongst the women I work with, are things like these conversations, right? Where people who are in our shoes or in a similar place in life, right? Other doctors talking about it, other healthcare professionals talking about it, hearing somebody else's story, maybe seeing yourself in that story. Finally, maybe a light bulb might come off where you raise your hand and you're like, actually, I think I am in that place and maybe I do need to seek some help. So I think these conversations are super important. And I'm glad that podcasts like yours exist to bring these kind of conversations to the public light. And I really do think that's an important and necessary first step. I think too, what helped me a lot is, this is a little bit of a touchy topic, but when I was, dealing with burnout and kind of struggling through things, what really clicked for me was hearing a message about the importance of my mind and emotions on a podcast, and I'm not talking about podcasts, but hearing that message outside of a clinical setting.
Right.
So, a lot of times, I'll talk about women physicians specifically, right? There is a lot of hesitation, right? Maybe to reach out for mental health support, right? And then there's a lot of barriers to actually getting that support. There's not enough, psychiatrists and mental health professionals available, first of all. And then a lot of people have concerns, rightly so, about, well, if I do try to seek treatment, what is that going to mean for my licensure or my job or my reputation and things like that. So there are a lot of barriers to, even when you recognize that you might need some extra support as a physician, to actually getting it. And so while I'm not saying that coaching is any kind of replacement for therapy or mental health treatment, I do think that coaching can, at least the way I do it, take some of those kind of concepts, right, that help improve our well-being, and thereby protect our mental health, and make those things accessible so that, at least we're not treating mental illness, but we are protecting ourselves, right, by developing these skills on the front end proactively, and making it less likely that we suffer from mental illness. So I hope that makes sense, but
yeah. And I think that's so true because, I happen to live in the state. I don't know how it's like for you, but, my licensure isn't at stake if I, seek help for my mental health, right? The language is something like, if I'm putting patients, at risk, of harm. But there are some states, and there are, probably issues around the world, right, with other treating physicians, where your licensure is worded in such a way that it makes you think that any dip into mental health at all that you seek, puts you at risk of losing your license or being on some kind of probation. And unfortunately we do hear stories about, people who've experienced that. I think you and I agree, right, that that's really wrong. That's really, it's well intended to protect the safety of patients, but it's wrong to make, physicians and healthcare professionals feel like they cannot seek the mental health that they need. And that's, contributing factor, unfortunately, for physician suicide and other, outcomes that we don't want to have. And I absolutely agree with you that coaching can be something that is not a substitute for, appropriate, workup and medication and, therapy for people who need it, but it can be a useful tool in order to help people sort of get a better sense of where their thoughts and their emotions and their mindset are. And for some people, that is going to be sufficient, to have them feeling better. For others, it may be something that helps them to see that they do need additional, true sort of medical help, right? True sort of psychiatric care and therapy. So no, I do think that's important. I was thinking as you were talking about the pedestal thing, right? If we can stay on the pedestal, even though we're often very uncomfortable, feeling like we're alone up there. But unfortunately, it feels like we have to fall or jump down in order to get the care and to be amongst people again. And I think that, that's kind of one of those barriers that you talk about, people feel shame or embarrassed or, like they can't ask for that mental health, even though it's so important.
Yeah. Absolutely.
Yeah. Well, let's pivot just slightly. And I'd love to get, sort of your take on high performing people with anxiety or depression. And I recently had a conversation with a patient who, has struggled with depression for many years. And he wasn't medicated, even though he certainly sounds like he should have been for many years. And he shared the experience of, being a high performer. He went to a competitive high school. He went to, an Ivy League, college, and, has done very well, but he talked about how hard it was. And I asked him, I said, did anybody ever offer you medication? And he said no, and he started to cry. And he shared the experience of his brother having been sort of a catatonic depression, so his parents sort of saw like, here's this high performing child who, is doing well in school and all of this. And here's this other child who won't get out of bed, and really holding that stark comparison, thinking that this one doesn't need medications. But this is also something that happens, to us as, physicians, right? Because we do go to work, we do take care of the kids, we do all of those tasks. And so it can look like we're doing fine, even when we're really struggling. So, if you would share, that's not really a question, but if you would kind of share sort of your thoughts and experiences in maybe sort of working with women physicians, who've encountered this and are really struggling to accept, kind of maybe a diagnosis or, to really understand that they do need help.
Yeah, another big question, a big topic, and so important. I actually did a whole talk on this in New Orleans last year at a medical conference. The talk was entitled "The Nuances of Depression in High Functioning Women," specifically, and this was to a room full of mental health clinicians and psychiatrists, and also primary care and OBGYNs, anybody who took care of mental health clinicians. And some of the takeaway points were exactly what you kind of mentioned, observing in that patient of yours. The talk was about women, but how, because physicians, and we'll just talk about women physicians, we are high functioning, right? And are kind of conditioned to continue to be that way, even when we're struggling and work in a system where we, can't take the time off and, are conditioned to put everybody's needs ahead of our own, et cetera, and smile and grin and bear and all those things, right? That a lot of times we're missed, right? The need for support is missed. One of my first jobs out of residency, I was the psychiatrist for an ACT team. ACT is ACT, it stands for Assertive Community Treatment. Basically, it was outpatient support for severely, persistently mentally ill people with like schizophrenia and things like that. Our patients were very obviously ill, and we would go to their homes or find them wherever they were, right, in the shelters on the corner of the street, and meet them where they were. to deliver care to them. And what was interesting about that service is a government funded, well-studied kind of program to help these people stay stable as possible in the community. And the point that I'm making is that they get that level of support, right? These services were developed to help them because their mental illness is so obvious, right? These are folks who have ended up in the hospital many times, or sometimes even incarcerated in the throes of a psychiatric decompensation. There's that obvious presentation that causes people to rally, right? And services to be created to help that group of people. Whereas when we're talking about high functioning people like women physicians, right? There is no such thing. We don't look.
Yoga.
It's yoga. Yeah, it's meditation.
Yeah.
At most, right? Or
at most. Yeah. Yoga during lunch or before work.
Pizza party, yeah, or a pen or something like that. Right. Yeah. There is no recognition. There is no understanding. There is no outward visual, clues a lot of times for a long time that folks are struggling. And the point is that women physicians die by suicide, right? At rates, from what I've seen, 130% higher than the general population. That's a lot. That's a lot. That's a lot. That's significantly more than the general population, even more than male physicians, right? We know that physicians in general die by suicide at rates that higher than the general population, but even more than the men are the women. And every time it happens, there's always the comment like people didn't see it coming, right?
Right. There might have been a very small window of, they seem to be struggling, but sometimes not even.
Yeah. Most times not even. And so, it's so sad. It's so sad. And like you said, it is a small window, if at all. Like, imagine how much time this person probably has been, struggling by themselves and still showing up at work and no one notices it. And so, it's a really big problem. The other thing about that whole high functioning thing is that when I first heard that term, it was kind of framed in a way where I've seen people use high functioning as like a badge of honor, like kind of like I'm
a high functioning substance, person with alcohol use or,
like it's showing, I don't know how strong or resilient or something a person is, right? Like something to strive for. I think in medical culture, unfortunately, the less sleep you get and the more patients that show up on in the, that you're called to see on your shift, the more beat down you get, the more gold stars you get for working really hard. And so one thing, one of my perspectives that I've been, trying to share is that high functioning is not a badge of honor, right? It's actually dysfunctional. When you think
it's
about
much harder to operate. Yeah.
Not only is it harder to operate, but think about why a person would continue to function when they're injured and hurt, right? I think it actually speaks to a level of dysfunction in terms of how they see themselves and their value system, right? They're so disconnected from their bodies, from their emotions, from their needs that they would be able to continue to show up and at work despite how they're feeling, for an example, or their coping strategies are such that they have compartmentalized or drawn such a line in the sand between, again, their own emotional state and what they need, that they're able to function and go to work every day. And of course, the outcome of that is people not getting treatment, basically, nobody noticing that they need help, conditions worsening, right? Moving from burnout to depression and then sometimes suicide. outcomes that we don't want. And like you said, and so, yeah, that high functioning is not only not a badge of honor, but it's also a sign of dysfunction. And so,
yeah, it calls to mind, kind of this idea too of, you might hear like some kind of a survival story, right? Of having to like hike out of the woods on a broken leg, right? Like if you were by yourself and you had no other choice, right? And we can, kind of see that celebrated as, heroism or something, right? If there were no other options and you had to do it, you could. Compared to finishing a marathon on a broken leg, right? Where the marathon, even if you're a serious marathoner, is a recreational activity, right? It's not a survival. You're surrounded by people, right? And you could stop. That's not heroic, really. Like people might still sort of put that up there as like, wow, look at this amazing thing. But it's like, no, that's really dysfunctional actually to run on a broken leg. And we should not celebrate that the same way we should not celebrate you continuing to go to work and, like working so hard and really suffering inside, because there is harm from that. And some of that will be not repairable, right?
Absolutely. Yeah.
Yeah. Oh, such an important, idea, I think, for people to understand that the training that we go through, again, makes us believe that our needs are not important. And, mental health is one of those needs, right? Where, yes, if you're high functioning, right, you look like you're fine, but really you're functionally working on a broken leg, right? Especially at sort of the extremes. I'll pivot a little bit, and I think, when I first entered practice, I never heard physicians ever talk about being on antidepressants or being in therapy. And I noticed a shift where people sort of started to mention those things quietly, like, yeah, I've been on Prozac for such and such amount of time, or yeah, I see a therapist, but it was still quite quiet. And I do feel like people have come to this place where they're more open, in sort of sharing that. And yet, not necessarily, they might be in treatment, with medications, they might be in treatment with therapy, but not necessarily sort of really living from a well place, living from a really sort of balanced place. They might say, well, I'm fine because I'm on these treatments. So just thinking about our work as coaches and sort of what it means to really be thriving and be living a life that you really enjoy. Tell me where you see kind of that intersection between sort of medical mental health and that kind of true sort of well-being and thriving, as you like to say.
Yeah, it's a great question. A lot of people think of mental health as like a dichotomous thing, right? They're like a black and white thing. Either you have the symptoms of a mental illness and therefore are diagnosed with an illness, or you don't, right? And if you don't, right, that means you're mentally healthy, right? If you don't have a mental illness, then
the absence of disease.
Yeah, the absence of disease, you're mentally healthy, right? You're fine, as you asked in your question. When in reality, mental health is that there's that continuum, either the absence or the presence of symptoms of illness, but there's another, intersecting continuum, right? Maybe going on a y-axis, if you can see where my hands are going here, where there is the absence or presence of wellness or well-being. And so they do intersect, kind of like an X and Y axis. And you can be on one side where you don't have any mental illness symptoms, or it's being treated, but be really low when it comes to markers of well-being, right? And when you're in that place, right, you're really not thriving, right? That's the person who, in your question, who doesn't have a mental illness or has it treated, but still is burned out, not enjoying life, relationships aren't great, not thriving, right? Kind of languishing, instead of flourishing and thriving. And so it's important to recognize that, right? It's important to recognize that, whether you have a mental illness or not isn't all there is to mental health and well-being. And that there is a place where you can be not only not struggling with the mental illness. And by the way, that doesn't mean that you don't have a diagnosis. That could just mean that it's been treated, right? You've taken the measures to treat your mental illness, because that's fine. You can still flourish and thrive with a diagnosis, but you have a lot of markers of well-being too, right? You have relationships and community that supports you, right? You're doing work that matters to you and that contributes to others. You have, a control over your internal state, like in terms of your thoughts and emotions, those kind of things. And so I think that's another shift, right? That, I want people to understand that there's another, that thriving and flourishing is really the goal for most physicians and for most people, and it takes more than just the absence of illness. It's a lot more than.
I like that idea of the intersecting sort of X and Y axis, because of course we're just nerds like that. But I like that idea, right? Of, we may have, a diagnosis that, is or is not treated, and, kind of work on things from that perspective, but also this other dimension where we really think about well-being and the thoughts and feelings part and the thriving part. Because I think that's just a really nice visual to help people sort of wrap their brains around, because I think for so many, if we're kind of imagining the X-axis as like the presence or absence of mental health diagnosis or even like treated mental health diagnosis, if we get to that place where, we're treated or we don't have a mental health diagnosis, again, we might be like, well, I'm fine because I don't have that, or like this thing is better. My PHQ score is better, like whatever we're looking at. But we don't feel good. We might not feel valuable. We might not feel, just really kind of alive and engaged. And that's really where, kind of that Y-axis element comes in of like, what, who am I as a person? What do I like? How do I manage my emotions when they come up? Because of course, good and bad emotions are just normal part of life, right? We don't want to be in this completely numb state. We want to experience the ups and the downs that happen and be able to manage that.
Yeah, absolutely. I think the important thing is just helping people understand that there is more. Sometimes people get to that point where, and I've really seen this, like where, again, there's no mental illness or their illness has been treated, and they think that, they're kind of left wondering, like, is this it? Like, is this as good as it gets? Like, my PHQ 9 has dropped, but
right.
I'm
statistically
not really
significantly improved. So
yeah, right.
Yeah.
But I'm not really happy. I'm not really engaged. I'm not really enjoying, and things like that. And I guess one message of hope for the person who is like wondering, like, hey, is this it? Like, is this as much as I can expect in terms of my mental health and well-being? There is another dimension where you can take that even further. And so, I guess I just wanted to put that out there. Not everybody even recognizes that there's more to it.
Yeah, great. And so somebody who, is out there listening right now, is really sort of hearing themselves in, kind of the stories that you've shared and the things that we're talking about. What do you want someone who's struggling right now to take away from this conversation? Of course, we've kind of crossed a lot of different intensities, right, of states, right? We've talked a little bit about, people feeling suicidal and a little bit about, kind of the lesser levels, if you will, of anxiety and depression and kind of that thriving. But, for somebody who's just kind of finding themselves feeling in that place where, on paper they look great, but they just don't feel very good, what do you want that person to know?
So many things, but I think that, primarily that, one, it's okay and you're not alone. I think the brain offers up a lot of thoughts when you are a person who is struggling with like high functioning depression and anxiety that will keep you struggling with high functioning depression and anxiety, right? By telling you that nobody will understand, or that this isn't a real problem, or I just need to work harder to work my way out of this, or I should have figured this out already. All those kind of things. I want you to be aware of those kinds of lies that your brain will, that the depressed brain will offer, because those are the ones that will keep you stuck in that cycle. And instead, understand that there is support available. I just wrote a post recently. The other part of the fact that there is support available sometimes is that we also have to be willing to receive it, right? Like we have to be willing to receive it. And so if you are hearing this, message and really resonate, especially with the high functioning depression kind of description, or just not feeling as good inside as your life looks from the outside, recognizing that this isn't something for you to work your way out of or think
work harder,
right? That usual physician way that we have of dealing with things isn't going to work for this, and reaching out to another person is really what is needed and what is going to help you move forward. So yeah, that's what I'd want to say.
Yeah. Oh, such a good reminder for us all. So thank you for sharing that. Tell listeners where they can find you and find out more about the work that you do.
Sure. My website is my name, www.jeannielawrencemd.com. And there you can find some information about the services that I offer. Primarily, I'm offering right now my private coaching program, Emotional Mastery for Women Physicians. I hang out a lot on Instagram these days. And so you can follow me there at Dr. Jeannie Lawrence, MD. And really that program is, my signature program and my way of helping women physicians who want to thrive, right? These are the women who may have be on the other side of like a big life challenge. They're trying to find a new normal. They want to, they're forward thinking and want to create, the life of their dreams and one that they can enjoy, but they want to do it in a way that supports them and supports their emotional well-being, right, in the process. And so those are the women that, I love to support and help thrive in a really balanced and emotionally well way. And so find me on Instagram, find me on my website. I'd love to hear from you.
Yeah, great. And we'll have links to all that in the show notes to make it easier for people. Jeannie, thank you so much for coming on. It's been a real pleasure to talk to you. Like I said, I've been looking forward to our conversation. Probably, since last year, I had it on my to-do list and it never got done. So thank you for joining me today.
I really appreciate the invitation. This has been a ton of fun, Megan. Thank you for all that you do.
All right, my friends, thank you as always for listening. Go check out Dr. Lawrence and find the links in the show notes. And until next time, thank you and bye-bye.
Well, that's our show for today. Thank you as always for listening. To learn more about my coaching programs, head to www.healthierforgood.com. And if you love this podcast, please drop us a review on iTunes or support the show by clicking the link in the show notes. Until next time, take care.